Questions were submitted ahead of time. Each elected official will provide a brief update of their work on the federal or state level at the beginning, and then I'll pose the questions in turn. We do have a limited time. If we don't get to every question that was submitted, don't worry. Those questions that don't get posed on the call will be answered by one of the offices afterwards, so you will get an answer to your question even if we don't get to it during the call. I'm going to invite each of our three guests, as I noted, to provide a bit of an update on their activities. They've all been very active, and we're very appreciative of the hard work and partnership of all three of them. And we'll begin with Congresswoman Elise Stefanik. Congresswoman?
Thank you, Gary, and thank you to the North Country Chamber for hosting this informational session. I know your team has been hard at work helping small businesses identify funding and relief opportunities and just getting the information out there. Our offices continue to work very closely with our hospitals, our county public health offices to continue to prioritize the public health aspect of this crisis. In addition, we are working very closely with SBA as well as hundreds, really thousands of small businesses who have reached out to our office at this point regarding the Paycheck Protection Program, which I know many businesses will have questions on today. I'm grateful to have SBA and SBDC, so that's the Small Business Administration's regional representatives, and the Small Business Development Center from SUNY Canton on the call. Grateful for their hard work. I know they are working overtime to process these loans and get the resources out to the community. We're also in close touch with our lenders, our local banks and credit unions and farm credit organizations who are working hard to take the incoming. So thank you, as always, and looking forward to participate.
Okay, thank you. Do we have Senator Betty Little with us? All right, we hope Betty will be joining us soon. We'll certainly bring her into the conversation when she does. Let me call on Assemblyman Billy Jones now.
Hi, Gary.
Hi, Billy.
Thank you for hosting this and putting this on along with the North Country Chamber of Commerce. I want to reiterate what Elise had said. You guys are working extremely hard to help our small businesses out in this, and especially in this difficult time, and working with our neighbors to the north who are so important to our economy as well. So I want to thank all of you guys for what you're doing. Want to thank my colleagues, Elise and Betty, for doing this as well. It's very important that we stay connected to our small businesses and to our residents during this time. As Elise had said, my office and I am working extremely hard. We continue to work hard. We want to be as transparent and get answers to our constituents and to the residents here. So we're working remotely, social distancing, but we do continue to work on issues dealing with small businesses, our local county governments. There are just a lot of people that are concerned and worried, and we continue to try to reassure them and give them the answers that they need. As Elise had said, we in our office continue to work with hospitals and local health departments. Public health is number one, of course, during this. And I continue to urge people to abide by the rules and that have been set forth by state and federal governments and our localities to make sure that we get over this as soon as possible. And the quicker that we abide by the rules, the sooner we will get over this. And just want to thank everyone, our first responders, our law enforcement, all of our essential workers that continue to go out there and work every single day, and also our healthcare professionals that are on the front lines battling this awful virus. So thank you, and can't wait to get to the questions.
Okay, I believe Betty is having a little problem with her phone. Has she joined us yet? Well, we know she's working that out, so she'll be joining us soon, but let's get started with the questions. First question, for those who are currently experiencing difficulties filing for unemployment insurance benefits, what is being done to fix the long-term waits, the website crashes, and the inability to speak with someone over the phone? Billy, I'm going to give that one to you.
Okay. Yes, certainly there has been frustration among people trying to get through the Department of Labor. We take calls every single day on this. by the moment, it seems, and I realize the frustrations people are having. Just to put in perspective, I know this isn't solace to anybody, but to put it in perspective, the DOL and the unemployment line is last week, one day, on a typical week, they would have 50,000 calls. One day last week, they had 1.2 million calls in one day. So the volume is there, but we have been working with DOL and the unemployment people to get this worked out. They have hired 200 more people to handle the volume, and I believe the governor's office said they're looking to hire even more people. They have all their available resources on this. They're pulling people from different agencies to work the phones to get people the answers, and I know that they're also working with Verizon to help set up a call center approach to this. And we have also suggested, my colleagues and I have also suggested, one of the problems is people are going through and doing this online, and they have to follow up with the call after it. We're trying to tighten up that process to maybe make sure, or to maybe, cut that call down, or maybe work a little better to make people not have to make that initial, that after call back. We think that might help in processing these sooner. And I want to say that please reach out to me, my office, if you're having difficulty or you're having issues initially getting through to unemployment. We're more than happy to help you. We have helped a lot of people through this process, and we will continue to do so.
Okay, thank you, Billy. Next question. How does the Pandemic Unemployment Assistance, PUA, differ from traditional state unemployment, including who is eligible, and where does one apply for PUA? Who'd like to take that?
You can take it, Billy, and I'll add.
No, go ahead, Elise. I'm sorry. Go ahead.
I was going to say the Pandemic Unemployment Assistance, or the PUA, it provides payment to workers who are not traditionally eligible for unemployment benefits. So if you're self-employed, if you're an independent contractor, or a worker with a limited work history, if you're unable to work as a direct result of the coronavirus public health emergency, you're eligible for an additional $600 per week through the end of July. That's funded by the federal government, but you still apply through your state Department of Labor. Is that right, Billy?
That is, yes. And like you said, this is for people that traditionally would not draw unemployment. And I have to thank the federal government as well for putting in independent contractors in there. That was a big plus to help people out. We received many phone calls on that when businesses or independent contractors first had to shut down. So we're happy that got through the stimulus package as well.
Thank you both. Yes, that's an important word to get out, because if folks have long understood that they're not eligible for unemployment, they may not have picked up yet on the fact that they now are under this special allowance. So we'll continue to help get that word out in the region as well. Next question. Does one need to first be denied for traditional state unemployment insurance benefits in order to qualify for PUA? Who'd like to answer that?
Sure. So the PUA is reserved for those who do not qualify for the traditional unemployment benefits. So, yes, you need to not be included in the state unemployment insurance benefits traditionally, and that's why the federal government reimburses the state for 100% of the pandemic unemployment assistance.
If I can ask a follow-up, the question is, I think, particularly keyed into, do they have to get a formal denial of traditional unemployment in first to qualify or not?
Do you know that answer, Billy?
Yes, I believe they do. And there has been a little bit of confusion on the website when people go on. That question is there, and they do have to be denied. But there'll be two sets of forms there, or two sets of boxes to say, are you applying for a traditional or the special PUA, and they do have to be denied before they can qualify, but they get denied and then they can qualify.
Okay, so that's good to know. So maybe a little frustrating that you have to take two steps, but on the other hand, you're accessing benefits you normally wouldn't be able to obtain. So get your denial of traditional benefits first, and then proceed with qualifying for PUA. Question number 4: for those who are self-employed or independent contractors who work in multiple states, which state should they file in? Billy?
Yes. This gets a little more into the weeds. I believe we've looked into this, and I would encourage people to, if they're having issues with this, the multiple state issue, that they need to get a hold of DOL, Department of Labor, to see, because there's various factors, where they do the most amount of business and what they, so there's different answers, I guess, to different contractors, different independent contractors. So we ask you that you get a hold of DOL, and if you're having issues getting a hold of DOL, certainly reach out to my office, and we will help you through that process.
Okay, thank you. Next question: for nonprofits that self-insure or self-fund for unemployment benefits rather than paying into the state unemployment insurance program, will there be support for covering the other 50% of unemployment costs? Who'd like to take a shot at that?
Sure. At the federal level, the stimulus package we passed, called the CARES Act, it reimburses half the cost of unemployment benefits for nonprofits who self-fund. I'm not sure if the state has looked at anything to help reimburse nonprofits beyond this. Another option, though, for our nonprofits is they are eligible for the SBA PPP loans. That's the Paycheck Protection Program, and we want to encourage our nonprofits to look at that opportunity as well.
Okay, thank you. We received several questions from small businesses, nonprofits, and others that have applied for the SBA Economic Injury Disaster Loan and the $10,000 cash advance. We have also received questions on the Paycheck Protection Program. We're going to pose some of those questions now. First, the SBA stated that EIDL loans and cash advances would be processed and dispersed expeditiously. The SBA website even stated that the cash advances would be released within 3 days of filing an application. It has now been 7 days, and I have not yet received the cash advance or heard anything further on the loan. When can I expect that I will receive the loan and cash advance? Congresswoman?
This is a really important question. We are pushing the SBA to process these loans as quickly as possible. I'm going to turn it over to Jeff Boyce from the SBA to add some details.
Congresswoman, thank you. Folks, good morning. And, as was said earlier in the call, the demand, the need, the interest, the urgency is just unprecedented. As you can expect, SBA and myself and my colleagues, we're working 24/7, really around the clock to do everything we can to move these programs forward. We're increasing staff. We're bolstering our systems. But just to kind of put this in perspective, the Paycheck Protection Program, for example, is the largest domestic economic recovery mechanism ever implemented in history, and that's at the initial $349 billion. We're hoping that amount grows. So just to kind of put it in context, that's what we're all wrestling with. But to the specifics, think about the 3 different programs that we have to offer, and I want to give you some sort of context for different time frames, right? So the Economic Injury Disaster Loan Emergency Advance is one of those 3. And as the questioner says here, the intent is certainly to disperse those funds in a matter of days. A target is 3 days. That is something that we're shooting for. This was an option that became available just last Monday. I remain hopeful that those funds will begin to be dispersed this week. But again, that is the most immediate source of assistance. So that's the EIDL Emergency Advance. The second option is, as the Congresswoman said, the P3, the Paycheck Protection Program. That is also meant to be a quick advance that hopefully once the application is submitted, they're working with the lender, those funds begin to flow, maybe not in days, but certainly in a week or so. So that's kind of an interim measure. That should be quick, but not quite as quick as that emergency advance. And then finally, there's the traditional EIDL loan. That's a tool that we've had in our toolbox from the beginning, and what's different here is we've opened that up to all small businesses across the state. That is a long-term working capital loan. The term can be as long as 30 years, and the information required to prepare, package, and structure that loan is much more significant. The borrower works with a lending officer. And so, again, just to kind of put it in context, the time frames typically for a traditional EIDL loan to work through from application to actual closing and disbursement is about 45 days. So think about the programs that way. EIDL emergency advance, the goal is 3 days. We're not there yet, but that remains the goal. PPP, the hope is that it's a little bit longer, but not that much. And then traditional EIDL, the application process is certainly longer.
And Jeff, based upon our call yesterday, you had mentioned that the EIDL loans are starting to get issued, that they are starting to be deposited into checking accounts, so to continue checking that as we finish this week up, correct?
That's exactly right. So, I mean, some good news I can offer there, some macro numbers that I saw yesterday from my colleagues. Over 400,000 loans have been approved, and that equates to over $100 billion in funding. So the good news is that process is working. Again, the demand is just unprecedented. There's so much more that we need to and will do, but at least we know that it is working and funds are flowing.
Okay, thank you. I'm pleased to note that Senator Betty Little, we've gotten her through the technical issues that were blocking her from joining us, and she's now with us. Welcome, Betty. We welcome some opening remarks from you as to what you've been doing and working on. We know there have been a great many things you've been involved in.
Well, thank you very much. I'm sorry for the problem, but I now know the numbers.
Technology.
So, yeah, all right. These are difficult times, and I think what we're really trying to do is to help people and try to work with our constituents to get them through the process. There's so many people doing so many good things, but it's affecting so many people too. And I do know that the state came out with their revised guidance today as to essential workers, so there may be some questions on that, and it didn't change a lot, though.
Okay, well, thanks for joining. Oh, go, please.
Yeah, I'm just glad to be on. I think it's great that Elise is doing these. Thank you.
We appreciate you joining us, as always, and as I noted in the very beginning, we thank all three of you for all that you've been doing, and certainly on behalf of the Chamber, all of your solidarity and partnership and response to questions and issues on literally a daily basis. Our next question, I have heard from SBA sources that the amount of the EIDL advance will be determined by the number of employees you have. It is my understanding that this calculation is not based on the provisions of the law and will limit needed assistance for other expenses that are not employee-based. Will this SBA rule be reviewed? Congresswoman?
Yes, this is an issue that we've been pressing SBA and, frankly, the Department of Treasury for immediate clarity on. The law allows up to $10,000 but does not entitle businesses to this entire amount. So we are working to push the SBA and Treasury to put out guidance and more information for our local SBA folks about why there are these reports of a policy of $1,000 per employee. There is no rule out right now, and that's a problem, and we have been working to address that. Jeff, did you want to add?
Yeah, I mean, I could just add that, again, what's suggested here in the question is accurate from my perspective. I think absent any additional guidance or direction, from Congress, this is the initial attempt, the approach the SBA is taking, this $1,000 per employee. But if we have the ability or the direction to offer more, certainly we would gladly do that and provide as much assistance as we can to each business and each person that applies.
Okay, thank you. The next question, I am a small business owner in Plattsburgh. Some of my friends who are also small business owners have received their EIDL deposits, and they are far, and they emphasize, underline, far less than what they were expecting. One indicated they received $30 and another indicated $155. Are these accurate amounts or is something wrong? Could you please look into this? Congresswoman?
Yes, we will absolutely look into this. Gary, I'll follow up with you offline on this individual question so we can get in touch with those businesses and address that immediately. Again, on the SBA EIDL loan program, you are eligible up to $10,000, and we've been really pushing SBA and Treasury to get the guidance out as soon as possible so the SBA is flying blind on this. Jeff, other thoughts about those amounts?
Yeah, I mean, I would just add, I tested this with my colleagues this morning, and again, their sense was this is not accurate. This should not be the case, and that the least amount that someone should expect, under the current situation would be $1,000. So these very tiny amounts do not seem accurate to me.
Okay, we will.
Gary, that's a good casework for us to follow up with you on and these businesses.
Good. We'll get that question and the identity of the woman who I know posed it to us to you after the call. Next question. We are a primary care medical practice. We were told by our bank on Monday morning that they are, quote, at capacity, unquote, and not taking more PPP loan applications at this time. Other banks that we have contacted have told us that they are only accepting applications from existing clients. What can we do?
Well, I
Gary,
think this indicates. Go ahead, Betty.
No, I was just going to say that community banks and some of our local banks are certainly trying to take care of their own consumers, their own clients, and then reaching out after that. But it probably is a problem because many people bank online and other places, and then they want to go to a local bank that they can work with on this for these SBA things. And it's the community banks who have been so good with SBA loans for so long, too. So they know how to do them, but I know that they are getting swamped.
To add additional thoughts to this, so we are working with our lenders to continue to build confidence around the fact that there will be increased funding for this program. As Jeff pointed out, this is the largest economic rescue package funded to the tune of $349 billion. Congress right now is negotiating an additional $250 billion that will hopefully pass before the end of this month. In terms of this particular situation, I would also encourage you, if you're having difficulty with local banks, local credit unions, if they have an existing relationship with SBA, they are also eligible to process these loans. And we will continue to work with our lenders to talk to them about how, yes, we understand that they're prioritizing their existing customers, but for those, as Betty said, that bank online or we're in this unprecedented situation to, make it as open as possible. Jeff, other thoughts from SBA?
Yeah, I mean, I would just say everything that's been said, to date is correct. This is, I think, an accurate representation of what folks are experiencing in these, very earliest days, given the tremendous demand. The advice we're giving folks is to shop around, is to contact, several different lending institutions, whether they be banks or credit unions, as was said. Most all of those are viable options for the 7A lending program. So that's one strategy. The other piece of the solution here, we think, will be bringing additional lenders into the program. And so just this week, there was a new feature, a portal, a mechanism added to the SBA website to enable other banks and credit unions that are not currently certified, authorized, empowered to participate in the 7A SBA lending program, for which the PPP flows through, to enable them to engage with us and to achieve that certification and be able to deploy these funds. That's certainly more of an interim, not an immediate strategy, but we think it's going to help and will be especially critical if additional funding is allocated to this program. Then we have essentially different pipelines to funnel that money out into the community.
I can add here at the Chamber, we've been interacting with our area banks on behalf of our member businesses on this issue as well. And very much like earlier was said, with the unemployment insurance applications being multiple times the norm, the same thing happened immediately after the starting pistol was fired on the PPP loan applications. We had one local bank who, as of yesterday, had received 30,000 applications and had to hit pause until others who were kind of in the queue will get to you, but we need to hit pause while we figure out how we catch up. I spoke with them today, and they're working to put more people to catch up with the backlog, but that sort of thing is happening with the banks as well, so we can only caution patience. Stay in touch with your bank, contact the person that you're working with every couple of days, and I believe most of them will catch up, but they're going through that same initial overwhelming response.
Gary, that's a great point. And just one more thing to add, right? So I know some banks wanted to build on their website some kind of an interface, a portal, a means for folks to electronically submit their application for the program, which I think is very wise because once built, enables a greater volume or throughput. So that took some of the lenders a few days to put in place. We were also hearing on some calls earlier this week that there were some lenders who were authorized to participate and wanted to, but were seeking additional guidance and direction from the SBA. And the good news is that that's been happening on a day-by-day basis. I'm seeing messages going out from the lender relations specialist in our office, literally on a daily basis to those banks and lending institutions, giving them that guidance. For example, now on the website, on the SBA website, there's a sample note that banks can use and much more detail. So I feel like some of that initial ambiguity has been relieved and puts them in a much better position to now move forward more confidently and take these applications.
And just to add on that, Gary, we are helping SBA and Treasury write that guidance in real time. So if our lenders are on this call, if there are certain issues that come up, please notify our office because we're literally working this at the highest levels of the Treasury and SBA departments. An example of that is there was initially a lack of clarity on eligibility for seasonal businesses. And while we had the intent from Congress was to make seasonal businesses eligible, banks did not have enough detailed guidance on that. We literally helped write that, working with our local businesses, identifying the issue with the lenders. I contacted the Deputy Secretary of Treasury, and they turned it around, and it's now part of the SBA guidance. So as these issues come up, please reach out to my office so we can help get the clarifications.
Okay, thank you. Moving away from the EIDL and PPP, a couple of other questions. What do the federal and state governments plan to do to help dairy farmers in light of the effects of the coronavirus? We are now seeing a complete collapse of dairy pricing and unheard of dumping of milk in the North Country. So now more than ever, we need to see support from you all so our farms and all of the businesses and employees we support can see a future. So I'm throwing this out to all three of you. Who'd like to start?
Yeah, Gary.
Yes.
This is Billy. This is an issue that obviously all of our businesses are important here in the North Country, but this is an issue that comes close to my heart. I was raised and ran our family's dairy farm for several years, raised on a farm as well. And to see the dumping of milk just really breaks my heart. And just as we were, dairy farmers were seeing a little light at the end of the tunnel. The prices had come up a little bit before this epidemic hit, and now they're going to plummet again. We realize that there is an excess of milk, mostly due to school closures and other small business closures that would take this volume of milk. But when we look into our grocery stores and we see limits on the amount of dairy products and milk that you can buy, it just doesn't make sense. So we need to bridge that gap for sure. Also, as I know Elise is very familiar with, we're calling on some federal support here because of a lot of the federal pricing guidelines. We want a temporary floor price per 100 for the average cost of production. I've written a letter to the Secretary of Agriculture on this. And also the excess milk, the product we have, we really should work out a system to redistribute that milk to food banks and other nonprofits that could use it, especially during times like this. So we really need to support our agriculture industry as a whole. We know how important it is here in the North Country, and our dairy farmers who have taken a hit for the last 5 years, and then to see milk being dumped, it's just heartbreaking. It really is. But then when you walk into grocery stores and other stores and there are limits on our dairy products, it just doesn't make sense. Also want to give a shout out to my office has been working with the chamber, and I thank you on how we can bridge that gaps for products here for our local stores and our local grocery stores. We're trying to bridge that gap between farmers and the stores to make sure that our shelves are full. It makes no sense to have empty shelves here in the North Country and in this area when we have an ability to deliver those products to stores. So I want to thank you, Gary, and your staff for the work that we're doing on that as well. And also on the state level, I would ask that, and I am making a plea to the Department of Labor as well to maybe scale back some of the labor mandates that were put in last year against our farmers and our dairy farmers for a temporary reprieve on those. I think that is important because those labor mandates do hurt farmers in the production. And people will say, you know what, a lot of businesses are hurting, and I certainly understand that. I do. We get phone calls every day. But agriculture and dairy farming is a little different because dairy farming, you can't just shut down an operation. The cows still have to be milked, production still has to go on, and they can't get rid of their product. And they still have those labor costs as well. So it's not like you can just close the door and shut down the lights and say, we're going to take a break for a while. Not that any business wants to do that, certainly, but they have different circumstances where they cannot do that. They still have to do and still have to have these daily production costs, and we need to do everything we can to support our dairy farmers and our agriculture.
Yeah.
In the North Country.
And I would just like to add, as Billy said, farmers are really getting hurt, and just when things get good, they seem to get worse for them. So God bless everyone who is farming and in agriculture. A second thing that's coming up as we approach spring in our garden farms, farmers markets will be able to stay open and sell and take place wherever they have before and more. But for plants and garden shops, they are not allowed to be open under the new guidance. So unless they're just doing landscaping and nothing that's cosmetic, which I need to get some clarification on it, and we'll work on that today. But, that's a problem, too. If people have, a garden shop in Hopkinton, they have beautiful flowers and all of that, but they've worked on them for months, and they need to be open when it's time to sell them.
And just to add here from the federal perspective, Billy is exactly right that we are looking at multiple options with USDA to provide direct support and relief for dairy farmers. And he outlines it exactly how it is. It's heartbreaking to talk to dairy farmers and hear about the dumping of milk, especially after the past few years where it's been an incredibly challenging time. And he clarified it. They're seeing the light at the end of the tunnel. The prices are going up, and then they're hit with this crisis of no fault of their own. What we're looking at with USDA is potentially a reimbursement mechanism for the milk that has to be dumped, or activating what's called USDA's Section 32 to allow dairy purchases to go towards food banks and other feeding programs, which I think is a smart idea given this crisis. And then there are other policy options that would incentivize producers to voluntarily reduce production to reduce our excess supply. I had a conversation with the head of the New York Farm Bureau who lives in our district and runs a dairy operation earlier this week, and I'm having a call with our local dairy producers district-wide to hear those ideas, share them with the Secretary of Agriculture, and I'm hopeful that this relief will be in a future legislative package because they are certainly going to need it.
Thank you all very much. Very, very important topic. Next question. COVID-19 has further illustrated the need for better cell phone and internet coverage for business, education, and safety in the North Country. Where I live and operate our business, we only have one internet provider that is not reliable, and our cell service seems to hover at 1 or 2 bars. Our ability to run our business and check in with our elderly parents are an immediate concern. What actions are being taken to make it possible to work and educate and stay connected to and from home? Well, we have 3 guests here who certainly have been leaders on this issue. What do you want to offer in terms of progress or upcoming activities?
The one thing I would want to say is the lesson to be learned here is that everyone has to have internet service. We have teachers who have not had any personal FaceTime with students in weeks, and we're talking about a few more weeks. And we have children I know in the Lake Luzerne area and rural areas up north, every place, and they don't have internet. And they can't even go to the libraries. The libraries are closed. The only place they can go is outside the town hall. And kids are not getting their education. They have Chromebooks. They have the things they need. Internet service has to become like electricity, and it has to be affordable and regulated.
Billy?
Yeah, I couldn't agree more. Gary, that we've all been working on this, and Betty and I were on the Upstate Cellular Task Force earlier. The governor appointed us to that. We realize how important this is, and this only exacerbates what we've all been saying and what people and residents in our district know. Obviously, education. If you have to work remotely from home, you need good, reliable internet and cell service here. So if there's anything that, any good that can come out of this, I think it proves the point that we've been talking about, you and my colleagues, that we need better service. And I was hoping there'd be more recommendations put forth out of our task force that we were on. The governor was working on some language, I believe, on it, but we need money put forth on this as well. We need to subsidize some of our carriers to make sure that they can get to our more remote places in our districts, and we need to continue to push on this. We've also been in contact, and my office has been in contact with providers. You know that there is so much use on it from everybody working at home, and obviously educators and teachers have reached out to my office to see if we can get discounts and to see if we can get more coverage to those areas. We've had some success, but we continue to work on this. But I cannot, I can't emphasize this point enough. Before this virus, we had done many forums and we had worked on it, and I had stated many times that at least 50% of the calls that come into my office from concerned residents were concerns over cell service or internet. And this, while we're going through this crisis, we certainly realize how important this is. And I really think that we will continue to press the case, but this really makes the case for better cellular and broadband coverage here in the North Country. And I know that the three of us will continue to push for more funding and more easement on regulations to get more towers and to get more placement of
and
cable
taller towers,
and et cetera. Yes, and I know you're going to mention that, Senator.
Taller towers. The one thing that I believe the North Country needs the most is more year-round residents. And as people are working from home now, and those who are in dense populations look to what we have up here, this may help us going forward, but we have to have the internet and the cell service. And if you don't have cell service, you can't, my understanding is, a school can't direct a hotspot to a child's home. So it has to be solved, and everyone has to get on the same page and move forward. And like Billy said, there has to be, not just a subsidy, but it has to be a subsidy to get them to do it, but also to make sure that it's affordable to every family.
Congresswoman, I know you've continued to work on this actively from the federal level.
Yes, and the federal government absolutely has a piece of this. I agree with Betty and Billy that this magnifies the need for broadband and cell access as critical infrastructure. And every house in this state, every house in America should be connected. It is inexcusable that some families have access to broadband and other families do not. What we have done in the interim, we've made incremental progress. We look at the broadband maps when I first was sworn into office, and there are positive news, but we need to do a lot more. Recently, a local broadband provider contacted me about the Keeping Critical Connections Act, which makes sure that the small broadband operators are able to continue to provide that essential service to people who may be unable to pay their bills. So I'm on that bill. I'm working with Peter Welch from Vermont on that. It's bipartisan. And then I've been in personal contact with Chairman Pai, who is chair of the FCC. We worked very hard to make sure New York State was included on the list of states eligible for funding under the Rural Digital Opportunity Fund, which provides federal dollars to expand broadband capabilities. So we're looking at it, but this crisis should drive this conversation immediately as critical infrastructure.
Thank you. This next question is for you, Congresswoman. It's my understanding that the U.S. has moved to cut Canada off from U.S. healthcare supplies and equipment. As you know, Canada is not only our trading partner, but a close ally who has always come to our aid, such as after 9/11 and during the Iranian hostage crisis. Any insight on when this might be resolved and if we will again allow the export of these healthcare supplies to our neighbors and allies? And on a personal note, let me thank you for your assistance in helping to make sure that the hundreds of Canadian healthcare personnel who commute every day to work in our hospitals in the North Country have been able to continue doing so.
Thanks, Gary. I've been in close touch with my Canadian counterparts. I had a conversation with the Canadian ambassador over the weekend. I also spoke to the Delegate General representing Quebec in New York on this issue. We've come to a much more reasonable place. A lot of this had to do with some of the discussions on 3M, which has been invoked under the Defense Production Act. Initially, I think the administration had a sort of one-size-fits-all approach to the U.S. exporting our products, given the need domestically, but they've come to a much more balanced, reasonable approach, understanding that our supply chain is so closely, we work so closely with our Canadian counterparts. So I think this has improved over the past few days. Gary is right. We did work on the NAFTA trade visa issue when they announced the closure of the northern border to ensure that our healthcare workers who are Canadian but work at CVPH, work at all of our local healthcare providers, were allowed to continue crossing the border, and we track that very closely if there are any issues. But it's a much more reasonable position than we were a week ago on this domestic manufacturing rule, and now we have the flexibility for them to export products to our Canadian neighbors who are greatly in need, just like we are here.
Okay, thank you for that. Next question. With the recent extension of the New York State Pause Act, the governor's executive order actually, do all visitors and summer residents need to self-quarantine if traveling upstate? If so, who will be responsible for enforcement activities? The local municipalities? What will the enforcement look like? Billy or Betty?
Well, this is something that many of the upstate communities and Department of Health are worrying about, as well as the health facilities. But, we like our second home residents. We depend upon them. We certainly are looking for them to be here. All we are asking is when they come from a population that has a high incidence of this COVID-19, that they self-quarantine. And I know that it will be the responsibility, according to the governor's executive order, to make sure that no one is gathering and that they are stay at home. All of us are. But we have to ask them to do it and then maybe offer some assistance of getting things for some people. But I think it will be up to the locals to remind them to do so.
Yeah, certainly. I agree with what Betty said. People are encouraged to stay home, but naturally, if people have second homes here, we welcome them. We always welcome them, but we just ask that they take the necessary precautions and self-quarantine, like Betty had said. We strongly advise that because there's not really a directive or an executive order out there telling people to do that, but we strongly advise them to do that now. Mm-hmm. And we welcome our visitors as well from downstate and other areas in the country. But right now, we're just asking that they be cognizant of what we're going through, and that if we can just get over this and get through this, we certainly want to welcome them back, and we will welcome them back with open arms. We like what they do here. They spend money. They support our small businesses. But just while we're going through this, public health is number one, of course, and we want to see that they follow proper protocol. And that should be for all of us, all of our residents, that we continue to abide by the rules set forth by the healthcare professionals so that we can get through this.
And I think more and more people are wearing masks and gloves and doing the things that have been recommended. The whole purpose of this is not to spread the virus, and we need them to help us do that too. A second issue that I've come up with is campgrounds. And the DEC campgrounds are closed until Memorial Day. And the other campgrounds, many of them have RVs and seasonal people who come to their campground. And those RVs are under additional shelter housing. So they would have to have their own bathroom facility in it, and they get hooked up for water and for electricity. But any campground that has these seasonals in them cannot open a public bathroom, cannot have a restaurant other than for takeout, cannot open their pools, cannot have any gatherings, entertainment, or activities going on. But for some people coming up to the North Country, National Guardsmen, Corps of Engineers, people who come in here to help with the health system, RVs, and some of these campgrounds have cabins as well, are a place for housing.
That's very good clarification, Betty. Thank you for that. I hope some of our campgrounds and seasonal lodging folks are listening. We're doing well on time. Let's see if we can do a couple more questions. Next question, how long do you anticipate before the North Country receives additional COVID-19 test kits and more testing can be done for the general public? Who'd like to start on this one?
I can jump in. This is the number one priority right now, and we are working with our county officials as well as our hospitals to continue to encourage the state to prioritize testing supplies for upstate. You know, I think ideally we need to get those quick turnaround test kits that rather than taking days, you're talking about getting the actual outcome within 15 minutes of what the test is, whether someone tests positive or negative. I think this is the key issue to get us through this and also to get the economy back up and running, because it will allow us to map this virus more effectively, because we aren't testing enough people right now to get our arms around this. I do agree with the counties and the hospitals in terms of prioritizing the healthcare workers and the emergency services personnel, given that the test numbers are limited. But, you know, week by week, day by day, we're putting those requests in support of the counties.
And I think that the hospitals do have enough test kits right now, and we need to continue to get more and get those faster ones as soon as we can. But in Warren County, they have just opened up a drive-through, and also Alice High has some of that as well. However, it's a procedure. You have to have symptoms. You have to have a doctor prescribe that you get the test, and the symptoms are that fever, cough, and shortness of breath. And then the doctor makes an appointment for you. They're done through the county health departments. Warren County is doing it now, and we'll be doing it, I think it's 9 to 1 during the day, and it's not just for Warren County residents. And Alice Hyde is doing it in Franklin County. So you still have to have the doctor's notice and all of that. But otherwise, if someone who's really sick and they go to the emergency room and they believe that you need to be tested, you will be tested at the hospital. But you have to have those symptoms, I think. If you get tested too early, then you think you're safe. And if 2 days later, you might not feel well and think that you don't have it, and that's when you may have it. So.
Yes, I agree. And in my office, and I look into this every single day by the hour. We're pushing our partners and the state and federal government to provide more testing. I will say that I'm in constant contact with our hospitals as well, and Betty had mentioned that they seem to think they're okay for now, but they want more test kits, of course. We always want more supplies and more test kits. And I've received many calls in the office, in my office, and my staff has. People are concerned. They have some of the symptoms, but I will stress you should call your doctor or your provider because Elise Stefanik and Betty Little and Billy Jones were not doctors. So we certainly want to be there to help and certainly call our offices, but you should call your doctor and they should take you through what you should be doing. The hospitals have said that the procedure stays the same, and our local health department has said that the procedure stays the same. Call your doctor. If you are critically ill, of course, call 911 or our first responders. Will take care of you. But call your doctor and get guidance from them, and they will recommend to self-quarantine. And if they feel that you're ill or you're very ill, they will certainly make recommendations there as well. But we should be taking all the precautions. We really should now in staying in place, and we will get through this the more that we follow the pause directives.
Thank you, Billy. I think we have time for one final question, and then we'll wrap up. Final question. The CARES Act was the third and by far the largest federal relief bill in response to the coronavirus. There have been conversations regarding a potential fourth bill. What is the current status of such legislation? What provisions are being discussed? And what are your priorities for such a bill? Is additional funding slated for the PPP and/or EIDL programs? For our state representatives, is there anything currently in the works at the state level for additional relief measures? Congresswoman, let's start with you on the federal level.
Sure. So the primary focus right now is making sure that what we funded in the stimulus bill gets to the individuals and the small businesses. There absolutely will be additional legislative bills. What's being negotiated right now to pass before the end of the month is an additional $250 billion to fund PPP. So that's the SBA program that was discussed at length that you're hearing about being overprescribed. We need to make sure that we increase those funds to make them available for small businesses. What I'd also like to see in future federal packages is funding for our rural hospitals and community health centers. We announced today that there was over $1 million given to Hudson Headwaters, which I know is important up and down the eastern part of my district, but they're going to need more funding given how challenging this has been. I also think that future legislative packages need to look at hazard pay for our healthcare workers and other individuals on the front lines. But so yes, there will be future bills. Yes, we are negotiating right now on an additional $250 billion for PPP.
Betty and Billy, on the state level?
On the state level, I believe that we're really just trying to get this unemployment working well, and I know that Commissioner Reardon has hired more people and working on their computer system that was being upgraded, but now they're getting it faster and better. So people need to keep working at that and extending the unemployment benefits as well as, working to see that the information is out there.
Billy?
Certainly pushing our leaders here in the state. I will have to say I was disappointed in the recently passed state budget. I was disappointed in many aspects on it, but I was disappointed that we did not do more in that budget at a state level for our small businesses. But certainly in the future relief packages, more relief for our dairy farmers, our small businesses. Certainly appreciate that. I will say, Elise made a great point. Our hospitals are going to need direct assistance. They're going to need direct financial help after this or during this. They're going to take a real hit. They really are. So I welcome the news that she is pushing for that as well. And I will also say that our this is bigger than New York State, and we do need more federal money. We do need more federal help on our local level, maybe more aid to localities, talking about county governments as well. They're going to take a really big hit on this. through the loss of sales tax. So I would also push for direct assistance to them as well.
Okay, thank you. We're coming up right exactly on time. So what I'll do now is ask each of you for any final closing comments you'd like to offer, and we'll start with the Congresswoman.
Gary, thank you to you and your entire team at the North Country Chamber. Thank you to all of our small businesses who are working during these really unprecedented times to ensure that we can get through this. Again, this is a crisis and nothing that we really could have envisioned to be in this situation. So continue to reach out to any of our offices with concerns, issues. We are here to help, and we will continue pushing the information out in partnership with our chambers. And I want to wish everyone during this holiday season, as you celebrate Easter this weekend or are celebrating Passover, I know it's difficult, but we will get through this together. And our healthcare and hospitals are truly the heroes and have been doing an amazing job. Thank you.
Right, and I'd like to thank everyone, too. Thank Elise for what she does to try to make sure that New York is at the forefront of getting funding, because we definitely need it. But some of the good things I think that have come out of this is the communication, the press events that we are seeing with the president and his wonderful team that's working with him, and with the governor and his team, with Dr. Zucker. We get so much more information than we've ever had when there's a national event like this. And it's coming from really good sources, not just from news media. So the other thing is the use of telemedicine. I think for our future, that's going to help a lot of people, because now they're getting used to it and trying it out, and it's working. And I think they're going to get more and better health care, particularly for people who are in rural areas and don't get out a lot. So, and the third thing, a lesson we should learn is our medical supplies should all be coming from the USA and from New York. We should never get caught in this again, where we depend on other countries for what we need. Thank you, and thanks to everyone. And I'll also wish everyone a good weekend, and they're good holy days as they go forward. And, getting some spiritual help is important in these days, too.
Thank you, Betty. Billy?
Yes, I want to reiterate what my colleagues have said. Thank you, Gary, for hosting this, and I want to thank Betty and Elise as well. We continue to put information out. Like Elise said, our offices are working. We're working overtime to take the concerns of our residents and to put out information. And I will say this, I always say this, please get your information from reliable sources. I know that all of our offices continue to put out newsletters and updates on a daily or a couple of day basis. That's important. We are getting out there. We're communicating with our constituents. And it's important that we have forums like this and we continue to keep those lines of communications open. I just want to say thank you to everyone. I know that people are struggling and they're frustrated. We field calls and emails all the time with people who are frustrated. We are going through an unprecedented time here, and it's difficult. I know small businesses are struggling, farmers are struggling, people are struggling in their day-to-day lives. They really are. But we will get through this. There are resources out there to help people. I want people to know that. And, we have to continue to abide by the rules and pay attention to our most vulnerable populations, our older folks as well. We need to look out for our neighbors, but we know how to do that here in the North Country, and we do it best, and we will get through this. But we just have to continue to be tough and to make sure that we're looking out for one another. I want to thank our first responders, our people, our essential workers that have to go out there every day, and they're protecting us. They're doing their jobs, our law enforcement, our correction officers, people on the front lines of in this crisis, in this healthcare crisis, our local health departments, emergency responders, and people in the hospitals that are working so hard. Our healthcare workers, they really are the heroes in this, and they're working hard to protect us and to make sure that our neighbors and our families are doing well. I want to say, we will get through this. We will get through this. We just have to keep following the rules, and we're strong here in the North Country, and we will get through this.
Thank you, Billy. I want to thank all who listened, all who submitted questions, and particularly thanks to our three guests for their time and their great answers today. A reminder that this entire program will be posted as soon as possible on the North Country Chamber website for you to go back and listen to or refer others to who may find it valuable. All questions that may not have been answered during the call-in will be answered by the various offices afterwards, so look forward to those answers. And I do want to say on behalf of the Chamber to all of the businesses out there, if you haven't visited our Chamber website or haven't done so recently, do so, northcountrychamber.com. You're going to be amazed, I believe, at the extensive information and links there on a variety of subjects. And apropos to what Billy was saying about our healthcare personnel, we yesterday launched a new initiative at the Chamber called Feed the Front Line. If you go to northcountrychamber.com, you'll find a place where you can contribute money, which will flow through the hospital foundations to help to provide food from our area restaurants to our healthcare workers. So take advantage. Let us know what we can help you with here at the Chamber, and thank you for calling in.